I'm Katie Spirit with the Hive, and I wanted to share just a minute. Many of you know the programs that we offer: Raising Resilience, Roots and Wings, the Phoenix Activity League, and Jay's Closet. But what you might not be so familiar with is our advocacy efforts. As an organization, our primary focus is the child welfare system in Maryland. What we propose is a shift from a child welfare system that, while not broken, as many would say, but rather was designed to be reactive, to a transformative family welfare system, one that is inherently human-centered, fueled by family services, and remarkably proactive. The state of Maryland data underscores that we cannot cultivate a robust child welfare system without a solid strategy dedicated to promoting the welfare of families. Our vision for an improved family welfare system is one that stands ready to respond to every call for help. The data presented in our child welfare report highlights the critical need for a shift for the CPS calls that end with no response to a community response. No longer can we afford to let distress calls echo in silence. Our proposal is a call to action, a commitment to answer every cry for assistance with a system that is not only responsive, but genuinely empathetic. I want you to imagine a system where each call for help triggers a swift and thoughtful response. Now, a CPS call that doesn't get screened in by a local office is diverted to the Hive's central office. Similar to the Handle with Care model used between law enforcement and schools across the country, a simple statement alerts our system that a referral has been made. No information other than the caregiver's name, contact information, and jurisdiction is provided. The Hive refers the caregiver to a community team consisting of a parent coach and a case manager in their area and monitors the services provided and subsequent outcomes. Our aim is to remove the stigma and fear that often accompanies intervention and replacing it with support and guidance. Community teams might be existing resources in a community who contract to provide this resources, or they may be teams assembled and deployed directly by the Hive. Our central office staff carefully tracks and reviews new and existing referrals, updating data in real time, and collaborating with the Department of Human Services to identify trends and barriers. By providing a response to the cases that are often screened out, we will reduce the subsequent calls that require intervention because we will be reaching families before crisis has escalated that far. With this approach, families feel seen and heard right away. They're met from where they are rather than from where we would expect them to be. They are met with a strength-based lens rather than one that focuses on their deficits. Family issues are treated from the root of the problem rather than placing band-aids on surface-level needs. As we venture into this, prevention becomes our cornerstone. By investing in a method for universal trauma screening that leads to maternal health care and pediatric care, and by strengthening community resources, we create an ecosystem that identifies risks early and intervenes before crises even occur. Together, we have the opportunity to redefine not just the system, but the very essence of family welfare, an approach that resonates with empathy, support, and a resolute commitment to the well-being of every family and child in our community. With the state of our current system, the barriers to implementing a strategy like this one includes the dissemination of funding and red tape at local level that prevents community organizations from collaborating with state agencies. With funding being constantly in arrears or reactive to crisis, grassroots organizations like ours that can best serve the need cannot sustain operationally. Additionally, without a clear crisis, families aren't even recognized as needing the proper level of support that would prevent the inevitable crisis that appears later. It always does. With the current practices in place, community based organizations must rely on referral from DSS workers in order to offer resources. Cases that are screened out are never diverted for services, and those that are screened in often lack a response that supports the strengths of parents. We've presented several strategies here that we would consider a solution to several of the problems facing children and families in the state of Maryland. One, we support an automatic referral system for CPS cases that are screened out to community-based organizations and a shared data system that tracks the services and outcomes for those families. Just as simple as ordering a pizza from your mobile phone. Number two, we support a strategy that implements universal trauma screenings in maternal health and pediatric care clinics to identify those who need the resources right away. And number three, we support a shift in state funding to reflect the drive to increase prevention efforts by disseminating funding quarterly in advance of services rendered.